Hi everybody, my name is Silvana Contepomi. I'm the president of the Argentinian Assistive Technology Association, and I'm here today to share with you an experience we have been doing during many years in a special setting in Argentina, and to share with you the gaps we've seen in wheelchair services in that area and what recommendations we do have for improvement that worked for Argentina. It's a middle and low income country, and so we have both, especially the low income settings or the vulnerable places are in very large cities where we have these villages, very crowded, and then we have rural areas, which I'm going to refer today, where we do have government and NGO programs to provide wheelchairs, but the results are the ones that we see here: abandoned products or inappropriate wheelchair. So we are going to talk about it. This happened in 2016, where I personally received from social workers a call to tell me that there were 8 people in this special area in Chaco Salteño, it's the name, children who didn't have a wheelchair. And I started saying, okay, I can help, but let me think. I need to understand what is happening there to see how to identify the gaps and how to improve, because I knew that there were NGO and government programs going there. So I wanted to understand more what was happening. The first thing we've seen is that all of them did have a wheelchair. They received a wheelchair from these programs before we've been there, these 8 people. Here are only 3 cases I'm going to show you. But all of them have received before a wheelchair. They were inappropriate, of course. Some of them were still in the wheelchair, not giving them function, or maybe making harm or hurting them. And some of them who had the wheelchair, as I said, they were not using it because they cannot stand there. No? So this was the situation. They had a wheelchair, they had programs, but this was the real life of the people. This how was this programs impacting the provision of the wheelchair at that moment. So we started analyzing what to do and how to do it, and we identified different gaps. I'm going to talk about the 2 main ones, the ones that we consider the main ones. And first we realized that the community, that rural community, had a very strong lack of awareness on how a wheelchair can change the life of the people, and of course the rights that people, the people with disabilities have in their community. So something has to be done there. And also, of course, the result of that inappropriate wheelchair was the lack of service provision. So we tried to change or to improve these 2 aspects. We've learned, as I said many years ago, we've learned that from the ICF that the context, that community can be barrier or facilitator. Our challenge is how to make that community a facilitator of these people. And also we learned since 2008 in the guidelines for wheelchair service provision in low-income countries that if we want a user to access the appropriate wheelchair, it needs to be done in a service provision plan. So what did we do? First, we used many strategies from the community-based rehabilitation programs, and also we trained in some steps of the wheelchair service training package the community. I must say that the kind of people that were assisting the people in need of a wheelchair, they were not health professionals, they were agents that were trained on what questions to ask, on how to look at the health of these people, and many social service workers, because it's a community that not only need a wheelchair, they need water, they need many other services for their daily living, no? So a lot of social service workers are in there. So we train all of them to become facilitators as a context. But then we also did improvements in the steps of the wheelchair service. As you see here, I put the years because the program is still running. So we started in 2016, and we said, how are we going to start with these 4 steps to change the service that they are receiving, that these people are receiving? So we didn't start from the first one, because we need, for assessment and selection, we need a personal, very with a lot of competence on how to do that. We didn't have that yet. We have it now, but not in 2016. But yes, we started doing some training for the social workers and health agents, how to get into the fitting, the training, and the follow-up to provide a better service. So I'm going to talk about this 4 steps. As I said, the assessment and selection step was done. We started in 2021, where there was this is a rehabilitation center, the public rehabilitation center. It's 600 kilometers away from the place, but it's from the same state, from the same province. So we started working with them on how to make to be trained to make an assessment and selection, so they can go more frequently. I live very far away from there. I had to take a 2-hour plane to get in there. I only can go once or twice a year. So this center, well trained, can do a much better job for assessment and selection. And I must say that today, in 2 years, we have 14 people of this center trained in the whole steps of wheelchair service provisions, but especially they're going to provide assessment and selection in this program, and 7 of them are certified by ISWP as a wheelchair service provider. No? That's a great improvement we've made. But at the beginning, since the very beginning, we started training people on how to do a fitting assessment, and how to not only the assessment, but also to find solutions to the problems they've seen in the assessment. So here we have some of the work we did there. We also train people to train the user and the families in some of the aspects at the beginning on how to use the wheelchair. We did workshops understanding how to fold the wheelchair, how to use the brakes, how to change, how to use the tilt, how to transfer, how to make some basic maintenance programs, and this and the need to learn this for training the families on the proper use of the wheelchair. The follow-up, it's an essential step in this program, and the only way we could think on doing this was at the beginning. Maybe it changes if we have specialists going there more frequently, but at the beginning was to do it remotely. And when they went to visit these people to their own settings, they should take a picture, send it back with all the things that they were identifying it were not working with the wheelchair or with the posture of the user, and we returned that picture with very clear things to do in terms of fitting again the person or changing any of the devices, so we can stay in touch remotely, and in that way they don't abandon the product and they can use it in the daily living. This kind of follow-up, you can read it also in the new guidelines of wheelchair service provision in the page 40 that the WHO has published recently. It's there, this case and this type of follow-up in this program. So now, 2023, some years after, so 7 years after we started these programs, we started with 8, but now we have 43 people in that community with appropriate wheelchair participating in community. I will share a little bit the cases. This was Joel with the no chair, but the inappropriate wheelchair, we can say. We found another chair. Up to now, the products we have them donated. They're not buying the products. We find them donated, but in a service model, so it's working. So we have Joel with her mom, with his mom, in the community, very happy to participate and to go where they want to go, to school or whatever. Then we have Nadia. Nadia, this was her wheelchair. You can see her here, sitting there. We started working with her, and our local people from there training how to do the fitting, the maintenance, and now we can see Nadia, that she can be sitting, playing with a toy, asking somebody what she wants, or what she can have her meal in there. She can go to school. She can participate in life, no? And then Alejandra was, we had to take her out of bed immediately, so we started with a stroller that was there, with some trying to do a cushion there and providing her something to come out. But then we found another chair, and we could provide her in a better service. And now we have Nadia in her community, sitting on a wheelchair, playing with all the other cousins and brothers in that community. Her mother going out with her, having a time with her, and as you see, she's part of this large community that she has at home, no, in the Chaco Salteño. So what I can tell you is that ISWP was a big support of all our work. We know that providing a wheelchair needs to it has many stakeholders going around in a system. We have to, all this work was done with the Ministry of Health of that area. We have to look at the policy, the type of products they can access. We have to train the personnel and have a good provision pathway, and all this has to be done in a service. ISWP with programs, they helped us on the training materials for the personnel. They also we also can share a lot of experience on others. We learn many much what others have done in this type of settings, and ISWP is the place where we can meet there and share this type of experience, learn, and then find improvements to be done in our low and middle income settings. We in Argentina are working hard to see if we can have people certified with the ISWP program, the basic program, and that will put us all in the same page of understanding that this is the framework where we have to start talking about on how are we going to do the program. So in our ideal world, we wish that both governments and NGOs in Argentina can understand, can be certified to be wheelchair service providers and work in this type of model that it's the one that makes really the difference in wheelchair service provision for people to be participant in their own life in community. So thank you very much.